Hi, greetings and welcome all again. This is Dr. Chandan, Scientific Director for Aikya Fertility. Today we're going to discuss about a very important topic, which even as an audience, as a couple who are eager to have pregnancy, will have always this question in their mind. Now, what makes them to become positive in an IVF cycle? It's just writing an exam and waiting for a result. You know, the better you study, your results will be good. When it comes to an IVF center, we face a lot of recurrent miscarriages or recurrent failure rather in IVF. So, what is that best which we are doing in IKEA is what we're going to discuss about today. We know each fingers are not the same. Likewise, each patients are completely different. Each patients are like a book for us. So we have to study them and understand them first. What is the issue? What causing them the infertility? We have there is people long back, they used to say there is something called unexplained infertility. There is nothing like an unexplainable. There are few things. That's what an IVF industry is running behind it, to find out what is that thing which makes sure that we can increase the chance of pregnancy. See, in IVF, if someone says that we give 100% success, no, it's not possible. No one can give 100% pregnancy, but each IVF center, with respect to the expert team, expert experience which they have, will try to formulate a different protocol that is tailor-made with respect to a patient medical condition. And this is what we incorporate and we discuss and make sure that we, whatever the best which we can, we give to the patient. Now, how we can avoid this failures in IVF is, first, the doctors or the IVF center which we are visiting should be having an experienced and well knowledge clinician and an embryologist. The clinical team and the embryologist team are like, I will always say this word, they are like two faces of a same coin. Okay, so a clinical team will completely analyze the patient, understand in a clinical level what all the best they can do. Say for example, in any patients, they are coming and we are seeing a recurrent failure, even having multiple IVF try, they are still failure. We have to understand why the failure. The reason for failures are very there are so many reasons for a failure. What we basically have to understand is what is the root cause for this IVF failure. So from a clinical point of view, they will ensure how the endometrium is responding when we transfer an embryo, which is very important, than just randomly transferring an embryos and expecting that that can result into pregnancy. Because there is something called window of implantation. When you transfer an embryo, the window of implantation will be open up maybe for a very short period. So your embryo transfer and the window of implantation should sync. So this, a clinical team will look into it, like what is the best time of embryo transfer. Again, when it comes to a clinical team, the how the endometrium lining is important. Endometrium lining is very important to sustain the pregnancy. So they'll make sure that how endometrium should be a proper lining so that they can consider the patient for an embryo transfer. And when it comes to an embryology point of view, what we generally look into is not only the shape of the embryo which matters. What matters for us, what is the genetic of the embryos is more important. An average embryo sometimes can result into a healthy pregnancy, or when we have an excellent embryo which is transferred, we have a negative. So patient, we always have a question from a patient that no, we had a very good embryo transfer, embryo grade was good, but still there is no pregnancy. Why is the common question we always get into. Now, it's not about the grade. Say for example, grading is just like a name for each embryo. Just like everyone have a name, it's just a name for us. Say for example, if I have a fever or any illness, just by looking at my face, you can't find out my illness unless you do a testing for it. So just like that, when just by looking at the embryo, you can't say that these are the capable embryos which will not result into miscarriage, definitely go into a pregnancy. No, we have something called a genetic testing. So by doing genetic testing for a patient who had a repeated miscarriages, we can identify the root cause Probably it could be because of the genetic of the embryo. The chromosomal anomalies will be very high, what we call it as an euploid and an aneuploid embryo. So we will do a genetic testing to ensure that what are the euploid embryos which can be considered for the transfer. That is one. Now we have an evolving technologies day by day. What everyone is talking about, the AI. AI has shown us little significant improvement in our pregnancy, because the knowledge of a human is limited. Say for example, if a human has to do a big calculation, they may need some time, but a computer just can do in a fraction of a second. Just like that, when you see a sperm, there are different information fed to a computer which will analyze that. When once the sperm satisfied all this feature, these are considered as a good sperm. So we feed the sperm into a AI system. The AI system will grade the sperm, and it'll ask us, so these are the sperm which you have to select for the embryo, for the embryo production or embryo creation. So like that, even for an embryo, we have a different AI tools which will say that which embryos are the considered embryos which that can increase the chance of pregnancy. So basically, to conclude, an tailor-made treatment and a customized treatment is important for all the patients in order to reduce the implantation failure. And all this customized treatment with respect to the clinical team and the embryology team, proper discussion is very important too, so that we can increase the chance of IVF pregnancy. Thank you so much.